Do you know how to identify heart blockage? It's a question that may stir curiosity in the health conscious and concern in those with a family history of heart disease. The answer lies in a procedure known as the calcium score heart scan, or coronary calcium scan. This non-invasive test detects and measures calcium deposits in the coronary arteries, the highways that supply blood to your heart. The primary goal of the scan is to assess the risk of potential heart attacks. Now, you may wonder, what does calcium have to do with heart blockage? The answer is simple. Blockage in the coronary arteries can lead to a life-threatening condition called myocardial infarction, more commonly known as a heart attack. This blockage is primarily caused by the buildup of plaques on the walls of the blood vessels, a condition referred to as coronary artery disease. Calcium deposits are an indicator of these plaques. The purpose of calcium scoring is to detect these plaques in individuals who show no symptoms. This is particularly useful for high-risk individuals with factors such as diabetes, high cholesterol, high blood pressure, or a family history of heart attacks. Also, individuals who engage in smoking or are suffering from obesity fall into this high-risk category. However, it should be noted that for those who have already been diagnosed with coronary artery disease, calcium score scans have limited usefulness. These scans utilize a high-tech tool called computed tomography, or CT, to generate images of the heart and calculate the amount of calcium deposits. So, what happens during this scan? The patient lies on a table that moves through a CT scanner. The scanner captures images of the heart when the muscles are relaxed. The resulting calcium score indicates the presence and amount of calcium. A score of 0 suggests a lower risk of future heart attacks. Despite the benefits of this scan, there are a few considerations to keep in mind. CT scanning involves radiation exposure, which makes it unsuitable for pregnant women. However, the typical exposure from the procedure is comparable to a year's natural radiation exposure. It's worth noting that calcium scoring cannot detect soft plaques that lack calcium and should be used in combination with other risk factors to assess future heart disease risk. In summary, a calcium score heart scan provides a non-invasive way to identify heart blockage by detecting and measuring calcium deposits in the coronary arteries. It is especially useful for asymptomatic individuals at high risk of heart disease. However, the scan has limitations and should be used as part of a comprehensive assessment of heart disease risk.